Welcome back. We are answering your questions about the coronavirus with Cone Health's Chief Physician Executive, Dr. Bruce Swords. Remember, you can text those questions to us, 336-379-5775. We'll keep that number right there at the bottom corner of your screen so you can text those questions whenever they pop into your mind. Dr. Swords, we have a question here. If someone has the coronavirus, they test positive, they quarantine, they get over it, no more symptoms, they go out in the world, they have the antibodies, they're interacting with people, is it possible for them to pick up the virus, be a carrier of it, and possibly spread it to people who don't have those antibodies?
Yeah, another good question. And the real answer is we probably don't know all the details there. It is unlikely that somebody who recently had coronavirus, has recovered, has the antibodies, is going to pick up the virus and reinfect others. That's unlikely. We don't have all the data, but I think that's something you don't have to worry about.
That's good to know. Someone asked, is the throat swab as accurate as a nasal swab?
Most tests rely on a nasopharyngeal swab. There are ways to get a adequate sample via the throat. It's not the recommended way for most lab tests, but there are studies coming out where maybe just a regular cheek swab or other swabs will be as effective. They're not in routine, regular use at Cone Health right now.
That's interesting. Speaking of testing, someone asked, what does an inconclusive test mean?
Yeah, in our system, and I think in most lab systems, an inconclusive test typically means that the sample wasn't adequate. And so it's not making a determination on whether the test was positive or negative. It's most of the time saying that the sample was inadequate and it needs to be recollected.
And this person writes in, I'm 77 years old, I'm diabetic and on blood pressure medicine. My 16-year-old grandson plays basketball and then he comes to hang out with me. They're wondering if that's dangerous.
Yeah, I'd have concerns in that situation. And so the young basketball player is healthy and can do whatever he or she's a grandson, so whatever he wants. The grandparent who has significant comorbidities that could contribute to a bad outcome with COVID should really take precautions. In an ideal world, they would stay very separated. Certainly, if they have to be together, they should stay in separate rooms and wear masks, even if they are in separate rooms.
And then another person writes in about going to the grocery store and trying to be as safe as possible here, Dr. Swartz. They say they wear a mask, but then the cashier touches and bags their groceries. When they get to the car, they sanitize their hands. But what else do they need to be doing to stay safe when they're out shopping?
It sounds like that person's doing a great job. And so just repeating what that person does, you go to the grocery store, wear a mask, use hand sanitizer before you go into the grocery store, collect your items. I would ensure that the cashier wash their hands with alcohol-based hand gel. I think that's great, and they're very good about doing that. And I think if you do all of those things, you're pretty safe.
And a couple of people have now texted in, are diabetics more at risk of getting the coronavirus?
I'll make a distinction. I don't think we have the data to know whether they are more at risk of getting the coronavirus. They certainly are at a higher risk of having a more difficult time if they're infected with the coronavirus. So people, especially with type 2 diabetes, are at risk for having complications of coronavirus, and so those folks should take extra precaution about hand hygiene, wearing a mask, staying away from each other.
And we spoke earlier about getting the flu vaccine this year, Dr. Swords, but how can we tell if we have symptoms of the flu and if we have symptoms of COVID-19?
That's a terrific question, and the short answer is you probably can't. The symptoms are very similar to each other. It will be a challenging flu season because people who have these symptoms and their physicians who are evaluating the symptoms will really be trying to figure out, do they have the flu? Do they have COVID? There will probably be a lot of testing this year around that specific conundrum.
And so I'm assuming if someone starts getting symptoms that are associated with either virus, they're going to have to be tested for both. Or if they do the flu test and it says you don't have the flu, are you going to assume that they have COVID-19? How will that work?
Great question, Maddie. Lots of folks are talking about that right now. Is in previous flu seasons, once we as a community got well into the flu season, if you called your physician or went to see your physician would say, well, sounds like you've got symptoms of the flu. Here's some potential treatment. Go home. We're not even going to test you. This year, we may think about that differently. Do we need to test you for influenza? Do we need to test you for coronavirus? It's likely that we'll be doing a lot more testing this year than we have in previous years.
Dr. Swords, thank you so much for joining us once again, and thank you for your questions.